Welcome, everyone. I'm Mark Haase. I'm the State Ombudsperson for Corrections. I'm also a board member at the Minnesota Justice Research Center. So just jumping right into it, the SARS Cov-2 or COVID pandemic has greatly, massively disrupted many aspects of our lives and how we do things. One example would be, the workplace, particularly office work. Those of us that work in offices know that the pandemic completely disrupted that. Offices, millions of people just went home and started working from home. And that completely changed how we see office work, right? Prior to this, remote work, working from home, I think was seen with a lot of skepticism, a lot of sort of, oh yeah, you're working from home. Some people did it, IT people, and some others did it. And I think it was starting to get some traction, but we suddenly learned that we can be productive from home, and there's a lot of benefits. We can, have more flexibility. We can have more work-life balance. Maybe there's also, downsides that we're still learning about. But I think the consensus is that we're not going to go back to the way things are. There's going to be maybe some types of hybrids and things where people have more flexibility in their workplace. And there's going to be good that's going to come out of that. There's going to be some challenges too. Now, when it comes to corrections, and particularly the decision whether or not we're going to put people, incarcerate people, put them in cages, was also disrupted. It wasn't disrupted quite as massively, but when you look at, for example, here in Minnesota, our local corrections facility populations, jails and detention centers in local, under local jurisdiction that aren't people that aren't going to state prisons, those dropped an average of about 40% around the state, 40 to 50% right away, really quickly. Some facilities dropped as much as 75%, and our state prisons had a relatively large reduction in populations too. In fact, they're still down about 24% from where they were prior to the pandemic. In January of 2020, the state prison population was about 9,400. And today it's down at 7,200 roughly. But some of those populations are starting to go back up, particularly local facilities. Hennepin County Jail is now getting up closer to where it was prior to the pandemic. And so the question for this, the core question for this discussion today is, what have we learned from this disruption? And like in the workplace, what are the possibilities for doing things differently? How can we do things better based on what we've learned from this? And I'll just say a fear that I have is that because of the different, the different context of corrections, compared to the typical workplace, people who have been accused of or have committed crimes, the way they're viewed, many challenges around that. My concern is that we're, unlike the workplace where it affects us all and we can sort of all relate to it and have a stake in it, we're not gonna really learn much, or we're not gonna take what we've learned and make some good changes. So the folks that we have on the panel today have a ton of expertise in this area from different perspectives, and they're folks that are going to be working on these issues from different perspectives going forward. So I'm really looking forward to this conversation. I'll do introductions here of the panel, and then we'll jump into the conversation. We have Sarah Cory, who is the director of the Ramsey County Attorney's Pretrial Justice Division. Sarah has been an assistant Ramsey County attorney since 2002. She's worked in juvenile and adult felony prosecution with specializing in domestic violence, arson, sexual assault, and child abuse cases. Currently, she's the head of this newly created division, the Pretrial Justice Division, which is responsible for the initial review of adult felony cases, arraignment and omnibus calendars, early intervention programs, and treatment court. I also know that Sarah was closely involved in the efforts when the pandemic started in this role to reduce the populations, the numbers of people that were being held to try to mitigate the spread of the virus. She has her BA from the University of Minnesota and her JD from William Mitchell College of Law. We also have Commissioner Paul Schnell, Commissioner of the Minnesota Department of Corrections. Commissioner Schnell was named to that position in 2019 by Governor Walz. He brings more than 30 years of public safety and corrections experience to his position. He has been a police chief. He has worked in juvenile detention. He's and juvenile corrections. And he has his social work degree from the University of St. Thomas and a Master's of Arts in Organizational Leadership from St. Catherine University. Our third panelist comes to us from New York. Lauren Brooke, or LB Eisen, is the director of the Justice Program at the Brennan Center for Justice and at NUI Law School. LB is director of this program where she leads the organization's work to end mass incarceration. Her team focuses on exposing the social and economic hardships that impact those who encounter the justice system and developing policies that shrink its size and scope. She has published a book on private prisons. She's a member of the New York City Bar's Task Force on Mass Incarceration and previously served on the Transition Committee for Brooklyn District Attorney Eric Gonzalez. Prior to being at the Brennan Center, she worked at the Vera Institute and also as an assistant district attorney in New York City in the Sex Crimes and Special Victims Bureau, Criminal Court Bureau, and Appeals Bureau, where she prosecuted a wide variety of criminal cases. She is holds an AB from Princeton University and a JD from Georgetown University Law School Center. And she also, prior to law school, worked as a journalist in Texas. So welcome to all of you. Really appreciate you being here with us today. And looking forward to this conversation. I'm going to ask each of you first to just give us a 3 to 5 minutes on what happened from your positions when the pandemic hit with respect to the numbers of people that we have in prisons and jails being reduced. For this part, just stick to the facts. We'll get more into analysis later on. And if you could keep your remarks to 3 to 5 minutes, I would appreciate it. Let's start with you, Sarah, if you don't mind.
Sure. So at the time that the pandemic hit, our jail population at the Ramsey County Jail was at about 393 people. With the basically immediate shutdown of court processes, jury trials, and things like that, we knew that there was a need, obviously, to act right away because it wasn't the case that a case was necessarily going to move along in the process to the next hearing. So at the immediate level, of course, internally, I have discussions with my attorneys. They are all prepared to go into court and really scrutinize cases for public safety and rely less on concerns about returning for court appearances, understanding that we don't even know necessarily when the next court appearance will be. As a system, we also were in a really good position to come together. We had a strong criminal justice coordinating council, which already included a number of stakeholders, thinking through some bail reform actions that we could take without waiting for legislative or constitutional changes. So we got together, and one of the things that we immediately did was we developed we worked together on drafting a court order where the chief judge would delegate authority to the sheriff who ran the jail to be able to release people who were brought in on warrants from complaints or failing to appear on cases, warrants for misdemeanors, gross misdemeanors, and then non-person crime felony cases with some exceptions. And we saw in the, between people just really kind of honing their focus on more, being mindful of the situation and this additional authority and discussions together as a system, we saw jail population go from 393 in March down to 194 people within a couple of weeks. And it stayed that way for quite a while. Like Mark said about Hennepin County, we are now seeing the numbers kind of creep back up to closer to where they were then. And then we also worked on a delegating authority to our community corrections department so that they would be able to release people either sentenced or serving sentences at the workhouse onto electronic home confinement. So that reduced numbers at the workhouse from 227 people down to around 100 people where it remains. And then just within our office, we also implemented a policy to decline charging fifth-degree drug possession cases absent some extraordinary or compelling circumstances. We worked together with the court to figure out ways to address warrants, either administratively resolving them or creating a kind of warrant that would allow for release with a court date. So those are a number of the things that we did just in the immediate aftermath of the pandemic.
Thanks, Sarah. Just quickly, are those court orders still in effect?
I'm not sure if the sheriff's court order is still in effect. Our court website keeps the standing orders publicly available. But we do also have a backup order, which is our pretrial service agency does a risk assessment and also has authority to release people without having to wait for their court date.
Okay, thanks. All right, moving from most local, expanding out, let's go with you, Commissioner Schnell.
Thank you, and thanks everyone for being here. I think I'll keep it really short. It was, I had started in January of 19, so in March of 2020, I think I just figured out like where the bathrooms were in the office, really, realistically, and so all of a sudden it was we have to do something. There was a continuance of operation or coup plan that was in place. There was also a pretty robust pandemic plan that was written. However, that pandemic plan was never tested. And so what ends up happening is we went to that pandemic plan and it didn't necessarily fit the sets of circumstances that we found ourselves. There was, I think, a lot of demand and calls for releasing folks. We began to look at, authority and what options there were. But I think one of the things that I would just say was really, as I think back, and it's hard to say, when we say what was the lessons when we're in the middle of it, we still, as we know, in our state is kind of one of the hot zones in the country for growth, and we have a significant outbreak right now at the correctional facility in St. Cloud, the prison in St. Cloud. So, we're still in the midst of it, and I just feel like we really haven't stepped away from it. So we're still learning, but there was this, I think, there was this somewhat strong sense that you need to get everybody out, and the jails had created, as Sarah talked about, like in Ramsey and other counties had created these orders to really reduce the numbers. But we had these issues around people being sentenced to us and commitment orders in place. And I think the other thing is that we oftentimes got compared to other places around the country where there was massive releases. And people are saying, look, this state just released 2,000 people. And we said, yeah, that's true, but we're the fourth lowest incarceration rate in the country. And to be sent to prison, and not in all cases, but in many cases in our state, it takes a bit more. That threshold's a bit higher, and because of our guidelines and so forth. And so what ends up happening is it's not as easy just to say we're going to just release all drug offenders or we're going to release this group of people. And so those were some of the challenges I think that we faced. Some of that there is a lack of recognition that everything is the same across the country. Or everything's the same even within the state or around practices, and yet that's not really the case. So I think those were some of the challenges as we looked at this. We certainly, I think, have learned much, but are still, as I said earlier, very much in the learning phase.
I just want to tease out a little bit of what you did, Paul, that I think that audience might be interested in. I know that your release programs had a smaller impact on the overall population than changing practices around returning people to prison when they're on supervision, right?
Yeah.
I mean, could you just say a little bit about what you did around and also, of course, the fact that the courts were backlogged lowered the population as well because people weren't being processed through, but just a little bit about what you did on release revocation.
Yeah, so I think we had really focused, I think, on just a number of areas. One was, we release about regularly between 500 and 600 people a month out of our system. And so that you can see that that's going to continue to happen as this goes on. Release violators end up constituting, somewhere around 12% of the population pre-pandemic. And so we started to talk about what were the things we could do to reduce those numbers of people. We established some really clear guidelines around what would need to be required. There had to be articulable public safety threat in order to bring people back. We instituted a number of practices related to considerations for warrant requests, things like what would be the implications on housing, employment, family, and what resources are missing in the community, because we wanted to make sure if there were things that we could address, we needed to address them. We implemented a relatively small COVID-19 work release program, where normally work release in our state, people go to a halfway house, or even may work out of a county jail. If you're in a greater Minnesota, you go out to work every day and report back in at night. We did some of that. However, we didn't release them to those congregate settings. We released them into the community with some monitoring. And then last, we did kind of conditional medical release, where we stretched the authority granted by statute to the agency to grant medical releases in some pretty rare circumstances, to apply some to the COVID that did not result in big numbers of releases, but there was some.
Great, thank you. So LB, is this reflective of what happened across the country?
I think I'll start by talking about jails, because that trend is a really interesting one and was promising in the beginning. And so I think it's sort of worth reminding people what happened very early on in the pandemic when it came to a lot of county jails. So what we saw very early on, March, April, May, June, July 2020, were that prosecutors and other local stakeholders were getting together in certain cities and saying, we're going to call for our peers not to prosecute certain low-level cases. So, for example, we saw a group of at least 30 elected prosecutors asking other prosecutors and asking local jails to release people who were deemed non-threatening to their communities. Baltimore State Attorney Marilyn Mosby in mid-March of 2020 announced that her office would dismiss pending charges against anyone arrested for a number of low-level offenses. And then by mid-April, we saw Chicago's Cook County Jail had released about 1,300 people, and that was about a quarter of its population. So it was a pretty significant release. And what happened there was that prosecutors, defense counsel, attorneys, sheriffs agreed to release a lot of individuals who were there pretrial. And remember, when we talk about local jails, a significant number, I have these automatic lights, a significant number of people in our local jails all across the country are there not because they've been convicted of a crime, but because they simply are too poor to pay bail. So we did see a lot of individuals being released who were not convicted of a crime, right, but who were just simply there because they were too poor to pay their bail. But unfortunately, we saw backsliding very, very quickly. So after reaching historical lows in the middle of 2020, by November of 2020, so by that fall, many jail populations across the country returned to their pre-pandemic levels. And this is significant because, as we all know, jails are a central locus of infection and spread not only because of poor conditions of confinement, but because of the enormous churn of the people who are in local jails. And that is a little bit different from prison populations, where people tend to be there for longer periods of time. And many of the people tuning in may already be aware that there are around 10 million admissions into county jails each year across the country. Now, those are not 10 million individuals, those are just admissions. And so some of those people are coming back and forth into their jails, but social distancing in jails is nearly impossible. Individuals sleep, dozens to a room, share bathrooms, showers, often receive inadequate medical care. And there was a really interesting report that just came out this fall that actually found and sort of confirms, right, what we all know, which is that jails are a very significant super spreader when it comes to COVID-19 and many other contagious diseases as well. And this report found that the churn in jail populations is very significant. This is a report by researchers at Northwestern University and the World Bank, and they found that the U.S. jail population has a 55% weekly turnover rate. So that's really significant when we talk about how these places are disease incubators. So unfortunately, while we saw at the beginning of the pandemic a lot of local stakeholders getting together and saying, we've got to make sure that we divert people from local jails and that we've got to release some people who were there pre-trial, we didn't see that stick, right? We didn't ultimately see this change to be long lasting. And that's a real tragedy when it comes to ending mass incarceration in this country, to reducing our jail and prison populations, because these are places where we have a significant number of people who really just don't need to be there because of the number of people in our jails who are there pre-trial. And so unfortunately, even though we did see these early reductions in jail populations, it was a very short-term trend.
Mm-hmm. All right, thank you. So the next question I told you I was going to ask is, what did we learn from this? And I just want to add something to that I think will be interesting for folks and helpful. Along with what did we learn, what is already sticking? What did we change that is already being institutionalized? I know there hasn't been time to change many laws around this, but I know, like Sarah, you talked about what you're doing in Ramsey County, I think. And of course, Commissioner Schnell, you have some authority to make some changes or work with others to make changes without passing legislation. So what did we learn and what is sticking? I'm going to start with you, Commissioner Schnell, to switch things up.
Well, I think certainly it's really so hard to say. I think we really are seeing ourselves more as a system. We oftentimes we've had a tendency to see, the community supervision networks and jails and prisons as kind of almost these separate kind of institutions and places. And I think we're trying to see more of the interconnectedness of this and the need for us to have higher levels of coordination. I think, the realities around in particular the COVID response was challenged by the fact that we in some cases had to make decisions that certainly prison wasn't the best place for people, but there wasn't other viable options either. We had not had a really solid development of good community-based resources, and in some instances, especially in certain areas, you might go to in the metro area, you might find that there's still considerable access to resources, but medical issues, access to medical providers for some of the folks who had medical issues became an issue. We had there was growing concerns about our ability to monitor people that we were releasing into their homes. Who was going to provide that, just some of that supervision from an accountability standpoint. but I do think that as we've moved forward, we have begun to talk more about the fact that we are a system, and we have to, I think, recognize the kind of the sympathetic nature of what happens between and across these supervision systems to jail and the prisons. We're seeing that right now as we look at our outbreak at St. Cloud. A portion of that we know came in from outside, from new admits that had come in, and you know, some jails are testing, other people are not. Some people will bring people in when they're positive, or I mean, we may not even know that or been told that. So I think there are things today that we want to make sure that there is much higher levels of coordination in these services. And then I think, you know, really recognizing the fact that, you know, these environments, you know, how do we make sure that the staff who work in them are also healthy, so that because they are going to be the people who, you know, we talked about this notion of the churn, right? The churn on a daily basis, and in the correctional facilities is the staff also, who can be bringing in virus. And so how do we maximize and really focus on the health there, and all the mitigation strategies? And that has been tough in the kind of, especially in the kind of the division that exists around, you know, the vaccinations and don't vaccinate, and all those different types of conversations play out in these settings as well. And yet, oftentimes forgotten in the mix of this is the sitting ducks that are in these correctional facilities. And so I think, you know, I think there's a growing level of awareness around that. I think we're trying to institutionalize some of the protocols that we had in place for things like, you know, release violations. That is a churn factor that we do not want to have happen. We need to bring people back when public safety is truly impacted, but as a general rule, it is not the best option. In fact, it produces in many cases the worst outcomes. And so that has got to be a top priority for us, is to find alternatives to address those issues. And I think we have concerted and focused efforts in that direction that ultimately will institutionalize some of this as we go forward.
And well, I know that you've received some pushback on, you know, your changes in criteria for revocations, and I think there's, you know, that comes from how things have always been done. Do you think that there's been attitudes have changed around that, or is it still a battle, or both?
I think it's both.
Yeah.
You know, certainly there's a lot of people who I think recognize and see that there are ways to manage these challenges, the needs and risks that people have in the community. But I think there's also a good number of people who say, you know, accountability has to be done in the ways that we've always done it. And in fact, in many cases, that's produced worse outcomes and more harm.
Thank you. LB, when you talked about jails, you know, you talked about, we've learned that they are a major source of infectious disease spread. And it seems like, you know, if you look at the numbers, we didn't learn much when it comes to jails. The concrete positives you can pull out of the experience for you know, what we've learned and maybe is sticking or has potential?
It's hard to be positive when we're talking about, you know, this country learning how to end mass incarceration, because this moment was such a pivotal moment for America, with you know, significant amounts of individuals in our jails and prisons, including, you know, those who work in these facilities, as the commissioner just mentioned, you know, correctional officers, educators, getting sick of COVID, dying of COVID. And, you know, the US leads the world as the #1 incarcerator with less than 5% of the world's people and nearly 25% of the world's incarcerated individuals. And many of the individuals in our jails and our prisons have a history of poor health care. They're elderly. In fact, about 40% of people held behind bars have at least one chronic health condition like asthma or diabetes that puts them more at risk of getting sick or dying of COVID-19, let alone, other diseases and viruses. So COVID-19 certainly brought into sharp focus the terrible conditions in some of our overcrowded facilities. We talked about how our jails and our prisons have become disease incubators. According to the Marshall Project and the UCLA has a project that has been keeping a lot of great statistics as well. As of November 12th, about 2,860 incarcerated people have died from COVID, along with more than 260 correctional staff members. And these are undercounts, right? These are just the numbers that, we're aware of. And, significant numbers of people did get sick, and many people died of COVID because they were in these facilities where social distancing is incredibly difficult. When it comes to lessons learned, I think, advocates, reformers, families of people who are incarcerated, stakeholders, people who work in and around these systems, were hopeful that we could change practices. But unfortunately, it's proven difficult. And although, the media certainly tried to highlight, how these places are, incubators of disease, we still see some local jails and some states, starting to increase the number of people behind bars. And, COVID is still happening in large swaths of this country. I think another interesting example and something that's really illustrative of the need and the evidence that we should be thinking differently about who needs to spend time behind bars is what's happening at the federal level. So, many of you may remember that following the enactment of the CARES Act, Attorney General Barr used his emergency authority to direct the BOP to place eligible incarcerated individuals on home confinement. And that was following the review of really extensive criteria pertaining to public safety. And so additional people were sent to home confinement to serve the rest of their sentence during the sort of emergency period that we're in now. And the recidivism rate of these individuals is staggeringly low. So only 3 individuals put on home confinement pursuant to the CARES Act committed new offenses, right? That is a 99.9% of individuals with no new violations. And when we look at public safety, these are more than 4,000 people who are safely serving their sentences at home. And they are all right now living under a threat of possibly being returned to federal prison, where we know that the BOP, the Bureau of Prisons, is currently understaffed. We know that a significant number of federal correctional officer positions are vacant right now. And the federal government, the Biden administration, has not granted clemency for these individuals, right, who clearly are no threat to public safety. And I bring that example to bear here because these individuals on home confinement really deserve an opportunity to reintegrate into their communities without the persistent threat of reincarceration. It's not a public safety issue. And, the administration still hasn't granted them clemency. And they are all worried, many of them, about returning to overcrowded federal prisons where they are at risk of getting COVID-19. And, if we as a country can't grant clemency to those individuals, I just think that says a lot about our approach to the criminal legal system.
Thank you. Sarah, is Ramsey County maybe a bit of an exception to the national trend? I know that the Ramsey County Corrections Center, which is the post-conviction local facility, is, as you mentioned, is still very, very much lower than it used to be. What has been learned in Ramsey County that is stuck?
Well, I think as a culture, Ramsey County is a little bit of a different place than other places, even in Minnesota. I think, you know, we have, even before the pandemic, had lower incarceration rates than other places. So I think maybe some things have endured or been strengthened by the lessons that we've learned from COVID when it comes to the post-conviction incarceration. Really re-examining or, you know, continuing to ask, is a confinement consequence really something that furthers the goals of public safety and you know, restoring this person, meeting their needs. And I guess the other, I do have a bit of an optimistic feeling about some of the things we've learned in this, even though it hasn't been perfect and some things are, you know, not permanently solved. But I think one thing we learned, at least in Ramsey County, is that, you know, it's not impossible to make a change. We don't have to get things to perfect before we can do something that really makes a difference. So, you know, the emergency nature of the pandemic created a situation where we had to come together and do something. We needed space in the jail. We needed people to be as safe as possible. And so where you normally have a tendency to really examine problems to the point of inaction, you know, I think that we showed you can act and examine and learn from it, you know. I think we're also very aware that there are, especially in times right now, people really want to have a causal explanation for things. That this thing, you know, is what we're seeing right now because of a decision you made yesterday. And, you know, we're learning that we don't, we need to do a better job. And I think that we've always just kind of known this, but we need to do a better job of collecting data, providing it to the public and to our system partners, and not just in a way that talks about what the work is that we do or the status of things, but in a way that helps us understand what we're dealing with and where to focus efforts. And I think that is not something that we have solved, but it is something that we are working on. We, you know, we received a grant in Ramsey County with a long-term technical assistance support to really help with that. You can even see on a number of websites in the county, in the state, across the country, where people are publishing their data in ways that help inform what's going on, regardless of how it reflects on the office.
And what the actual results are, right?
Right.
Yeah.
And then the other thing that I think we have learned and are acting on is just the way in which community has been missing from the solutions. So really developing true community engagement and solving these problems along with people who are most impacted, people who are closest to what the problems are, and having their input in a way that they are advising and creating the solutions along with us, rather than us imagining what we think would work best. And then
how are you doing that in a nutshell? Like,
yeah, well, so
we just got done on that session on participatory research. It sounds a little bit like that.
That's exactly what we're doing. As part of our bail reform alternatives initiative, we have partnered with Research in Action, and they're coming into Ramsey County to work side by side with us to make sure that the community voice is at the table, to make sure that what the decisions that are made, the data that is found, is being explained to our community members, and that they have the opportunity to ask questions in a way that makes a difference for what the ultimate decisions are going to be. And I think, we've learned that some of the community engagement that we've done hasn't been truly representative of community. And so the research partner that we have, I think, is really going to help us develop a sustained community table in Ramsey County.
Great, thanks. So now that we've got about 15 minutes left, the big question: what needs to be done what needs to happen to apply systemized lessons learned going forward? We've kind of touched on this, and as we have this discussion, I think a lot of us, when we saw the vast drop in numbers, particularly at the local level, we thought, well, now we can just say, look at what we did. These are, we don't have to have this many people in jail pre-trial. But it's, then we also started to see increases in crime rates. We talked about this a little bit prior to the session starting. And so, maybe we're not going to be able to use this moment as a lot of sort of leverage to make change, and we just got to continue with all the arguments we've always been making about what works best. But and so we can open that up, sort of generally. But is there anything specific to this experience that is going to help us as we move forward? Anybody want to just jump in on that one?
I'm happy to jump in there. I think that it's really important. We have decades of evidence indicating that long prison sentences do not make us safer. The Brennan Center's done original research. We published a report a couple of years ago where we actually found that long prison sentences don't deter crime and are counterproductive for public safety. And we have a report called How Many Americans Are Unnecessarily Incarcerated, and it found that when it comes to public safety, almost 40% of people who are in state and federal prison do not need to be there in terms of public safety. Either they should have been diverted in the first place, or their sentences are just far too long. And this includes people who are there for, who've been convicted of violent crimes. Our prison sentences are extraordinarily long when we look at other democratic countries across the globe. So it truly would be a mistake to double down on the punitive policies of the past, where the evidence shows us that they just don't work. And we at the Brennan Center are working at the local level, state level, federal level, really working with partners and advocates, policymakers, trying to educate the broader public, educate policymakers. And, when we focus on shrinking that carceral state, right, which is the, 2.2 million people behind bars, plus the 4.5 million people on probation and parole, we look at front-end solutions, such as bail reform, diverting people from jail and incarceration, reducing unnecessarily long prison sentences, which is, sentencing reform. At the back end, we've also got to focus on making the sealing of criminal records broader, faster, automatic. Policymakers can make it much easier for formerly justice-involved individuals to find a job, to secure a professional license, obtain housing by providing automatic sealing of criminal records. We've got to remove barriers to housing. In many cities in the US, individuals who have a felony conviction are simply ineligible, as are their family members, to live in public housing. And we need to better fund reentry programs across the country for people who are released from prison, and provide them with housing and jobs. We've got to invest in these community-based programs that support permanent decarceration and diversion from the justice system. And it will become clear that the system just didn't need to be so big in the first place if we really double down on all of these solutions.
Yeah, on that note, Commissioner Schnell, could you speak to you mentioned it earlier, but that issue of, if we're gonna look for alternatives to incarceration, which, you know, we know can be a very harmful approach, what do we need to, you know, what did you find out from this about alternatives and what we need to do there?
Well, I think some of it, some things that Sarah talked about, that LB talked about, I think we have to, you know, double down on really building out what it is that people need, making sure that those resources are there. And I think in particular, the inequities that get driven by the lack of resources in some places and the plethora of resources in others also create challenges. So, you know, I think it's how do we build a more equitable system and make sure we're funding that to create levels of equity. You know, I would also say that, you know, I think we need to find ways to, you know, to take some of the dynamics of politics. I'm not talking about partisan politics. I'm talking about just the issues around fear of crime in general. I think, as LB talked about, you know, one of the issues that's happening right now in our state that will get probably very little attention, but is the Sentencing Guidelines Commission looking at the issue of custody status point. That custody status point policy that the guidelines is used for a long time has a significant bed impact. And the commission is right now, December 16th, there will be a public hearing on that particular issue. Now, it's weedy in the sense of what is custody status point, but these are the types of reform things that I think ultimately impact. You know, if we can focus on the front end, it has big impact on the back end. And oftentimes it's going to be small things that you know, the incremental small steps that make a big difference, number one. And number two, I think it's really critical now, more than ever, that we're talking about what does work, what makes sense, what the research talks about, because if we don't, the alternative counterpoint is that anecdotal evidence of that really tough incident that happened. There's going to be a story on Care 11 tonight about a revocation issue. These are things that ultimately we have to make sure we're telling the whole story as well as possible, and talking about what works and what doesn't, as opposed to, you know, issues around the creation of further fear that drives and has led to really horrible policy.
Thanks. Yeah, that issue of the anecdote, you know, and the fear factor that is, you know, sometimes real, sometimes manipulated, has been a long, you know, that's what's driven much of our mass incarceration system that LB has talked about. I don't see any questions in the chat here. If anybody has any, please speak up. Is there anything that you panelists would like to say that we haven't covered that you think is important for folks to hear? Let me look at my question.
I would just also add that I think the more we can focus on things that, you know, as we start to find those, you know, the examples that LB was talking about with those federal folks who have, you know, demonstrated their ability to be pro-social and not a threat to public safety. When we can do that, when whatever that is, when we can create those conditions to be able to get people out and really focus on how we do justice reinvestment or reallocation, and because I think one of the challenges we face is we can't build a bigger system, and the resources for that become challenging. But there are ways, I think, real ways for us to begin thinking about how it is that we identify those folks who have, you know, done what they needed to do. They've invested in themselves. They've found the right resources. They've addressed some of the challenges that they face. They've accessed responsive kind of programming services that have made them feel successful. You know, I think as we think about the workforce challenges that our country is facing, that our state's facing, this is an opportunity for us, but it's going to mean that the, you know, people on this call and others are going to have to really get with employers to say, how do we create this sense of the folks that are in our correction systems are viable options. They may need some support, but in the long haul, we know from hearing from lots of employers who access these folks that they may have to think about things like housing. They may have to think about things like transportation. But in doing that, the dividend for them is a long haul, and frankly, the dividend for the community is long haul. So I think there are some opportunities that COVID's presenting, but we're going to have to really connect with the people who can help build those kinds of resources, employers and others, to make that happen.
Mm-hmm.
Sort of building on what the commissioner said, we also really need to look at ways to divert people from the criminal legal system entirely. So right now, judges are often, will order a split sentence or, probation. And those people are then part of the sort of correctional supervision system when oftentimes they don't need to be there, right? There's no public safety issue. They could have just been diverted from the system or not arrested in the first place, or their case dismissed. Additionally, we at the Brennan Center do a lot of work on criminal legal debt, these legal financial obligations that individuals are saddled with. And it's really important that the broader public and policymakers also understand the economic injustice that the criminal legal system perpetuates. We are truly extracting wealth from poor communities and communities of color through our, fee and fine system, through lost wages that affect people who have a conviction. Even a misdemeanor conviction can have significant wage impacts on someone's ability to earn a living wage, across their entire lifetime. So we've really got to do more, I think, to educate policymakers and educate the broader public as to the harms that the criminal legal system creates. And, that can hopefully change hearts and minds.
I think one thing that's going to happen is some of the changes that have been implemented as a result of the pandemic are going to gain some traction and create some changes that we're just, we're not necessarily going to attribute to the pandemic, or, it's kind of like one of these conferences, especially the in-person ones, where a bunch of people get together and sometimes they're criticized for just, talking about the same problem, but you have people connect on various issues and they go off and do something and create some change that you never hear about. One example is in New Hampshire. I think it's New Hampshire. It's a small northeastern state. Because of the backlog in court cases, they've started a program where a retired judge is going around and holding alternative dispute resolution versions of criminal pretrial work, where they bring in the victim of the crime, the perpetrator, the defense attorney, and prosecution, and this isn't just like plea bargaining. This is an actual mediated resolution for the case. That can result in a better outcome for everybody. It's not a full-fledged restorative justice like we heard about yesterday, but it's a restorative justice sort of light that I think for certain cases could lead to completely different ways of doing things that they could, is happening in New Hampshire and others can learn from. And I think there's just many things like that. I know in Ramsey County, specific reason that they've reduced the post-conviction incarcerated population is they're just not, Sarah, you kind of mentioned this, correct me if I'm wrong here, but they're just not doing the workhouse anymore. Like, in other words, people who are already authorized to go to work every day, they're not having them coming back into the corrections facility. They're just having them stay home, and they're, I don't know if they're on monitoring there, but they're already out in the community. So why have them keep coming back and forth from a corrections facility? And I think, that's a change that might hold. So I think, I think there are going to be some good outcomes here. I hope that that's true, and that we can also, lens, and I think also just some attitudes. I think the pushback or the contentious at times, back and forth on when somebody should be returned to prison or not. It forced people to really wrestle with that and look at what is the best option. We've got 2 minutes remaining. I am just going to kind of wrap up by saying thanks to all of you. I hope that we've made some connections here that are helpful for folks and provided some information that's helpful. Thanks, Jessica, for helping facilitate things. Thank you all for joining us here today. Any final remarks? All right. Thanks, everyone. Take care. Keep up the good work.